So if we took this example with Mr. Johnson and his pain as the keystone issue related to his postoperative recovery, and how if we concentrated our efforts on promoting comfort and controlling his pain, some of these other nursing care issues might be resolved. I talk about framing, and I think in your program you talk about what's your perspective. And so a model that I use to kind of help students understand this is, again, the outcome, and this would be the present state. And then right here is the test, the gap. So if this was, for example, post-op care, we were framing the situation or the perspective of post-op care for Mr. Johnson. And the present state is pain. The outcome is comfort or pain control. And here you might even use a visual analog scale as your test a little bit. From 0 to 10, Mr. Johnson, how's your pain? From 0 to 10, how's your pain? Clinical reasoning requires that you sort of consider both of these things at the same time, the juxtaposition of the present state and the outcome state. And that's where a lot of people don't go the second step. They identify the problem, and then they say, well, my outcome is no problem, the negative definition of the problem state, which really doesn't get you anywhere. And so this model is OPT, Outcome Present State Test. We've identified, based on our complexity analysis and synthesis of all of the nursing care needs for this patient, we've identified the keystone issue as pain. We know that the opposite of pain, the complementary nature, is comfort or pain control. Where we are now is we could use something like NOC, Nursing Outcome Classification Systems, to begin to identify what are the criteria that we want to achieve in order to achieve comfort measures for Mr. Johnson. And then down here we've got decisions to make about interventions. And here you might even consider using NIC, Nursing Intervention Classification Systems, to help you move to this situation to transition the person from their present state to their desired state in order to get to a clinical judgment, which is where I think all of the complexity things move us to, is the nature of clinical judgment. And there are 4 C's in clinical judgment. First of all, you have to have the contrast. And our contrast here is present state, outcome state. Second of all, you have to have a criteria. And so your criteria is whatever you specify as outcome achievement in regards to this particular situation. Third, you have to have concurrent consideration, which again is sort of a complexity-inspired issue in terms of what interventions can I influence or enact to get Mr. Johnson from this state of pain to this state of comfort. How many decisions, what sort of, am I going to use imagery, am I going to use analgesia, am I going to use mobility, am I going to use positioning? You have to consider how all of these interventions influence the present state in order to achieve the outcome state, concurrent consideration, and then your 4th C is conclusion. And it really is very simple. Have you outcome achieved? If not, why not? Or maybe, is there another issue to consider? And so I think complexity really kind of helps you appreciate all of the dynamics associated with all of the multiple nursing care needs that clients have in the context of their story, based on your assessments and your analysis and synthesis of linking and looping and looking at explaining what the theoretical and the hypothetical relationships are between and among all the nursing care needs. And if you use this structure, OPT, Outcome Present State Test, it helps organize your thinking in relationship to maybe NANDA, nursing diagnoses, NOC, outcomes, NIC interventions, and it will give you the metrics that you need, as well as the clinical vocabulary to reason about the complexity of patient care situations.